everyone, this is Island Nurse and welcome back to my YouTube channel. Now in this video, we're going to be talking about the therapeutic management for diabetes. Now let's go ahead and start our discussion. So diabetes is typically managed with a combination of diet, exercise, and medications. So let's begin with the diet. Now, the American Diabetes Association advises that we use the My Plate method, and this is where we start with a 9-inch plate and we separate the plate in imaginary lines. So half of the plate would be filled with vegetables, and these would be your non-starchy vegetables. So things like carrots, broccoli, spinach, tomatoes, cucumbers, those sorts of vegetables must fill half of your plate. Then 1/4 of your plate has to be lean protein. So lean protein would be like fish, chicken, or turkey. You want to avoid fatty proteins such as pork or beef. Although you can have them occasionally, but you should not have them too often. And then the other 1/4 of your plate should be filled with whole grain or starchy vegetables or just starchy food. So you can have pasta, you can have things like brown rice, you can also have eddos, yams, sweet potatoes or English potatoes. So that would be that 1/4 of your plate. And then on the side, it's advised that you have a serving of fruit, and you should have as a drink, you can have skim milk or 1% milk. You can have some low-fat beverage such as iced tea, or even better yet, you can have water. So this is the My Plate method, and this method is good for anyone, even if you're not a diabetic. And some other dietary tips that would be helpful for diabetics include, for instance, if you are eating out, if you go to the restaurant, you're eating out, it's a good idea for you to share meals, because oftentimes when you go to a restaurant, there are some very large portions, and remember, you have to be concerned about portion control. So you want to share meals. Also, you want to ask for fat-free dressing if they do have. You also want to ask for your meat to be boiled or roasted or broiled rather than fried or stewed, because you want to get the healthier version. Also, very important for you to remember, you need to eat 3 meals a day. As a diabetic, you don't want to go into hypoglycemia. You need to eat at approximately the same time each day so that your body becomes accustomed to a routine. You want to eat the same amount daily. So not only do you want to eat at the same time, you want to try to eat approximately the same amount of food each day. And this is so that your body is going to become used to the amount and type of food that you eat. Also, avoid skipping meals. That's very important, because you don't want your blood sugar to go too low, because that can be very dangerous. Also, this is something that's very important. You want to drink your weight in ounces of water. So for instance, if you weigh 155 pounds, you want to drink 155 ounces of water. And if you are unsure, you can always use a measuring cup. If you're going out for the day and you need to take water, you can use a measuring cup and then pour that water out into your water bottle, so you know exactly how much water you're drinking. And you want to avoid simple sugars like cookies and sweets and candies, because these tend to cause your blood sugar to rise very quickly, and we want to avoid that. We want to keep your blood sugar in a normal range. Let's go on now to speak about exercise and how exercise is useful in managing diabetes. So, what are the benefits of exercise? Exercise helps to lower your blood sugar very quickly, the glucose in the blood very quickly. It improves your body's ability to use insulin. So exercise is said to help the cells of the body to be able to utilize the insulin, and in that way it reduces your need for insulin. So if you can manage your diabetes without insulin just by diet and exercise, that would be really good. And also it reduces your risk for complications, and in a subsequent video we'll go on to talk about some of the many complications of diabetes. But exercise is very useful whether you take medication or not. Now there are some points to remember if you're exercising. So if you're taking insulin or other medication that would cause your blood sugar to become very low, you want to check your blood sugar before you exercise. That's very important. And there are patients who are diabetic that have the glucose machine at home where they can check their blood sugar regularly. And certainly if you are a diabetic, it's advisable for you to have one of those machines at home where you can do your self checks. So you're going to check your blood sugar before you exercise, okay? If the blood sugar is under 100 milligrams per deciliter, you want to eat 15 grams of carbs before exercising. So if it is 100 to 250 milligrams per deciliter, that's good, you're good to go, you can go ahead and exercise. And if your blood sugar is over 250 milligrams per deciliter, and we're talking here about a fasting blood sugar, you want to go ahead and check for ketones. Ketones are a byproduct of the breakdown of fat. So what happens is when your body does not have enough insulin, it's unable to convert the glucose into energy. In the absence of glucose, the body needs to turn to another nutrient in order to convert that to energy. And the body turns to fat and breaks down fat. And the byproduct of that breakdown is ketones. So it's very important for you to check your ketones as well. And of course, when we're talking about exercising, it's not vigorous exercise. We're talking about exercise such as walking, swimming, and cycling. Let's go on now to talk about medications that are used in diabetes. So we have insulin, of course, and insulin is used for type 1 diabetes. It can also be used in type 2 diabetes if oral antidiabetics don't work. And there are generally 4 broad classes of insulin. We have rapid acting, and this insulin begins to act in about 15 minutes. So it means that if you take rapid acting insulin, you have to have food right in front of you to eat right away, so that your blood sugar would not go to dangerously low levels. Then we have our short acting insulin, which begins to act in 30 to 60 minutes. We have intermediate acting insulin, and that insulin begins to work in about 2 to 4 hours. And then we have our long acting insulin, which begins to work in 6 hours. And we also have a range of oral antidiabetics, which we will delve into in another video. And as the nurse, one thing that is very important for you to teach your patient is sick day management. So let's talk about that. If you're diabetic and you're at home and you become sick, what should you do? So first of all, you need to report any illness that increases your blood glucose. You want to see your doctor after 6 to 8 hours if you become worse. If your condition does not improve in 6 to 8 hours, you want to go to see your doctor right away. Monitor your blood glucose and your ketones every 2 to 4 hours, like I mentioned about ketones before. Report any blood glucose level that is over 250 milligrams per deciliter, or if your ketones are increased for more than 6 hours. And also you want to report to the doctor if you can't eat for more than 4 hours, and also if your temperature is 101.5 or more, you want to report all of that to the doctor. You need to continue your insulin, so even if you're feeling sick or you're throwing up, you need to continue to take your insulin. Once you have been prescribed, continue to take your insulin. You want to have at least 8 ounces of water every hour. If you find that you can't tolerate the water, then have at least 2 teaspoons every 20 minutes because you want to keep your body hydrated. And again, even if you're feeling sick, you're vomiting or you have diarrhea, you have to try to continue to be eating your regular meals. And remember, you don't want your blood sugar to go too low, which can be fatal. So let's talk a little bit now about hypoglycemia and how we manage that condition. So hypoglycemia refers to excessively low blood sugar. So hypo means low, gly referring to glucose or sugar, and emia refers to the blood, so low blood sugar. So what are some of the symptoms that you would see if you have hypoglycemia? You're going to have weakness, you're going to feel cold and clammy, you're going to be very shaky, you have headache and dizziness, you have difficulty concentrating and irritability. Now, in order to manage hypoglycemia, we have what is called the 15-15 rule. So what this rule says is that you have to check your blood sugar. If you check your blood sugar and it's less than 70 milligrams per deciliter, you want to have 15 grams of carbohydrates. So 15 grams of carbohydrates would be like half cup of juice or soda, and it's regular soda, not diet soda or reduced sugar. It's regular soda because you're trying to get your blood glucose up. 8 ounces of skimmed milk, 1 tablespoon of sugar, regular sugar, 1 tablespoon of honey, or 4 to 5 pieces of hard candy. And this is why we say to diabetics that it's important for you to always carry around something sweet in your bag, just in case you become hypoglycemic. So you check your blood sugar. If it's below 70, you have 15 grams of carbs, and again you recheck it after 15 minutes. If it's still low, you go ahead and have 15 grams of carbs, one of these, right? Either or. And if at the end of that it's you recheck it and it's still low, after that you need to see your medical practitioner. You need to go and see your doctor. So let's go ahead now and talk about hyperglycemia, and this is the opposite of hypoglycemia. So high, glyc related to sugar, and emia, the blood. So high levels of sugar in the blood. So let's say you do your fasting blood sugar and you notice that it's above 120 milligrams per deciliter, and you have these symptoms. So you're extremely thirsty, your mouth is very dry, you start to get blurred vision, you have nausea, vomiting, and abdominal pain. In a situation like that, you want to go visit your physician right away, because hyperglycemia can lead to ketoacidosis, which is a complication of diabetes, and that is something that we'll get more into. That is something we'll talk about in our next video. And finally, let's talk about foot care for diabetics. Now, this is very important because one of the complications of diabetes is that it damages nerves, and when nerves are damaged, people can have an injury and they're not able to feel. So a diabetic may have a scratch, or they may even step on a nail and they're not able to feel it. So it's very important that we teach our diabetics proper foot care. So one of the first things that we want to encourage diabetics to do is that they should wear shoes at all times. So they should never walk about the house or outdoors without shoes. Also, you want to make sure that you examine your feet daily. So even if you have to take a mirror, look for bruises or cuts or scratches. And if you do have any of those, you want to check. You want to see your doctor about managing those. You want to use mild soap. You don't want to use soap that is too harsh, that can dry the skin. When the skin becomes too dry, it is easy to crack. And you want to pat dry your skin also, just to reduce the friction, which can lead to damage of the skin. Also, you want to remember to keep your nails short, and you should be visiting a podiatrist regularly if you are diabetic. You also want to ensure that you wear clean socks daily. So you don't want to reuse socks or stockings, and of course you have to ensure that the socks are not too tight where they're going to be cutting off your circulation. And finally, you need to remember to check your shoes before wearing them. So sometimes when we walk outside, you know, sometimes we can have little pebbles or stones in our shoes, and then when we wear them, it causes friction, and then that can lead to skin breakdown, and that can be extremely dangerous for a diabetic. So we want to encourage our diabetics to practice good foot care. So there you have it. We have spoken about the therapeutic management for diabetes. Don't forget, in our next video, we're going to be talking about some of the complications associated with diabetes. And I hope that you have found this video useful. Thanks for watching, and see you next time.